We will now move forward with our first panel of the conference, titled COVID-19, Health and Beyond, where the panel will discuss the health implications of the pandemic. Allow me to welcome the chair of the panel, Dr. Yaseen Arabi, the lead co-chair for the COVID-19 Multidisciplinary Approach to Complex Problems Task Force.
Thank you very much, Your Royal Highnesses, Excellencies, and colleagues. It's given me a great pleasure to chair this session on COVID-19, health and beyond. The T20 has recently established a new task force that focuses on COVID-19 with the goal of consolidating the best thought leader from around the world to provide policy recommendation and courses of action to reduce suffering and expedite the transition to reconstruction. The new task force aims to help frame the study issues linked to the current crisis and organize under overarching themes such as health, socioeconomic consideration, supply chains, education, markets and financial institutions, multilateralism, and climate. It gives me a great pleasure to introduce the panelists for this session. I'll start with my colleague, Dr. Reem Bunyan. Dr. Reem Bunyan is a consultant neurologist and a clinician. She's specialized in multiple sclerosis and autoimmune neurology. She's the CEO of the Center for Improving Value in Health and the co-chair of the G20 Health Working Group. On the panel also, Ms. Michelle Boccoz, the Director General Envoy for Multilateral Affairs and the WHO Sherpa for the G20. As the Director General Envoy to Multilateral Affairs, she's driving and strengthening the areas of health, diplomacy, strategic engagement, and communication for the WHO. As an experienced diplomat from France, she served as the French Governor Ambassador for the fight against HIV and AIDS and communicable diseases prior to joining WHO. On the panel also, Dr. Maria Kerkhove, who is currently the technical lead for COVID-19, the head of Emerging Diseases and Zoonoses Unit, and the MERS-CoV technical lead in the World Health Organization Health Emergency Program. She's an infectious disease epidemiologist who specializes in outbreaks of emerging and re-emerging pathogens. Dr. Kerkhove's main research interests include zoonotic, respiratory, and emerging and re-emerging viruses such as avian influenza, MERS, Ebola, and Zika, and others. I had the pleasure to work with her for years for the MERS-CoV outbreak. So thank you all for joining. I would like to ask our panelists maybe to give a high-level introductory of their thoughts on the health issues related to COVID-19, and then we'll move to some specific questions. So may I start with Dr. Reem Bunyan. Dr. Bunyan, the floor is yours.
Thank you very much. Good day to everyone, and it's an honor to be part of this conference and to be side by side virtually with an esteemed panelist with senior leaders from the WHO. Also, I would like to give words of thanks to the T20 for putting together such an impressive program. In the few minutes that I'll kick us off, I would like to make a few remarks addressing how health systems are now responding to the pandemic with a few main points. The first point is on health systems. So health systems are complex adaptive systems. They exist to deliver a triple aim. This is very familiar to us in the field of healthcare, but to those of us who are listening in from other fields, the triple aim is better health, better care, and at a lower cost. And this pandemic reminded us that health links very closely to social determinants of health. And these are very much far from healthcare facilities. And the example of this is where you live or your socioeconomic status. And these things are often of a significantly higher impact on people's health. Resilient health systems are critical, and investing in health systems is extremely necessary for us to deal with such a crisis such as the pandemic we're dealing with at the moment. Focusing on wellness versus treatment, focusing on access and equity, effectiveness and cost containments. All of these are elements for high value. What we learned from the pandemic are lessons that are around the full cycle or full elements of a pandemic preparedness and response, surveillance, prevention, early detection, detection and identification of people infected with a virus, early and effective response from a public health perspective, and recovery, which we heard about from the opening remarks by both His Royal Highness, the Minister of Energy, and His Excellency, the Minister of Health. And we also heard about this from Dr. Tedros. What's coming next, which is I think the theme of this conference, we truly can't fully forecast and imagine what the future is going to be 6 months down the line or so, and we will for sure have a new normal, as we heard from His Royal Highness Prince Abdulaziz. From a health system perspective, some of the themes that we think are going to be very important to us are several things that we're observing from the responses of health systems at the moment. Dealing with the backlog, people with conditions that require elective procedures that have been postponed and put on hold. Forecasts tell us that health systems would require up to 12 months to go through this backlog with up to 20% increase in capacity of health systems. Another point is mental health. Mental health issues are going to be very important. People are now dealing with a lot of stress in relation to the pandemic itself. Lockdown has its negative effects on mental health, and we predict that this is going to be a very important area. And lastly, learning from the innovations and the speed of movement that happened during the pandemic response. And some of the things that we will need to move into are new ways of delivering care, new models of care, ways of providing care. And the main area that we've observed development in, and it has been a welcome effect of the pandemic, is the acceleration of digital health. Thank you very much.
Thank you very much. May I call on Ms. Boccoz to give her introductory remarks? Need to unmute the microphone, please.
Can you hear me now?
Yes, thank you.
Thank you. Thank you very much, Chair, and thank you very much for the T20 to convene this meeting and to give us an opportunity to discuss indeed COVID-19 recommendations, ideas, and thoughts about it. As you know, in the framework of the G20 presidency, Saudi Arabia presidency, we've been working for some time now on really assessing what the gaps are in terms of COVID-19 response, and beyond that, what are the main gaps in health system. So I think that has allowed us to go through a number of topics that have also been raised by Dr. Reem right now, but has showed us that we have huge gaps still to look at and to address, be it in institutions, in policies, in health systems, in response, in data. but also in innovation. There's a number of buckets that we are working on and we have identified in trying to look at how can the world work together in a better way. What kind of response do we need to build up? How can we prepare better? How can we address better the lessons learned from COVID, and how can we make our health systems stronger, more prepared, and better fit for the future? So there's a number of answers that have already been given by Dr. Tedros also in his short speech, showing that there are areas where we need to learn to do better together. One of the key lessons, of course, being that we have to work in solidarity and we have to work much better together. We are also thinking also of what the next steps can be and how can we move forward to build the world back better, as Dr. Tedros said as well. So this is very much the discussions that have been ongoing with the G20 presidency, and we're really grateful that that allowed us to really engage into in-depth thought into building the world back differently afterwards, but already going to what are the areas where we need to do better individually, country by country, as organizations, but mostly collectively. The G20 has been very much in the lead in this reflection process, and we're very happy that WHO is contributing as a key partner to these reflections. Thank you very much, Chair.
Thank you very much. Dr. Maria Brankov.
Thank you very much. Can you hear me?
Yes.
Your Excellencies, thank you so much for the invitation to speak here, and a special hello to you, Dr. Arabi. It's very nice to see you. So thank you for the chance to be on this panel today and to offer some thoughts. Just a few minutes of overview of some of the work that we do as it relates to COVID-19, because I'm not sure if everyone online is completely aware of what we do. My role within this is the technical lead. And we have an incident management system that has been established since January 1st for the response, which involves all of our regional offices, all of our country offices, everyone here in headquarters based in Geneva. And our focus is around science, solutions, and solidarity with an overall aim to suppress transmission and save lives. And what we are doing through our response is supporting governments, supporting all people everywhere in partnership with many public health institutions, with scientific agencies, through multidisciplinary teams to develop guidance and advice for how to bring these outbreaks under control. And there is no dichotomy between public health versus livelihoods. It has to be both. We have to focus on both. We can't have one at the expense of the other. And I think this has shown us, and many of us have known this already, but none of these outbreaks, these pandemics, are ever public health alone. They never involve only the public health sector. They involve all. And so we work in partnerships with our member states, with everyone everywhere, through the UN system, with governments, but not only ministries of health, with all other sectors, because all sectors have been impacted by COVID-19. With industry, with civil society, with technology, and those that are at the forefront of artificial intelligence and digital health and all of this new innovation. How do we harness that to help in pandemic situations like this? With academics and other professionals and with varying backgrounds and different technical backgrounds, with financial systems. And not only that, with the young, we've engaged with children, with adolescents, with parents, with older individuals. How do we, when we make our advice and our guidance, how do we reach all people everywhere of all age groups, with vulnerabilities, with disabilities, in high-income countries, in low-income countries? And so what we do is we put together materials and guidance at the global level, which is adapted for regions and for countries to fit national action plans to fight, prevent, be ready, and react to COVID-19. But it's not only that. So as we will be talking about today, it's about how do we also maintain essential health services beyond COVID, because all systems are impacted right now. And if we save people's lives from COVID-19, it can't be at the expense of people dying in childbirth or for other health systems or other health reasons. And so we are working very hard to make sure that the response is agile and adaptive, and that we are supporting governments to adapt their current interventions as needed based on the situation they are in this pandemic, while focusing on the fundamental elements to be able to suppress transmission and save lives. And I'll stop there. Thank you.
Thank you very much. Dr. Bunyan, you highlighted the importance of resilience in healthcare systems as a very important part of the response to the pandemic. And the COVID-19 pandemic certainly has shown the importance of having a strong public health sector. What are your thoughts regarding policy action that should be taken to strengthen national capacity to respond to potential infectious disease outbreaks?
Thank you. Health systems, strong and resilient health systems are absolutely necessary in dealing with crisis situations. And these are health systems that focus on meaningful health outcomes. They focus on improving efficiency and effectiveness, managing costs, and also access, equity of access of health services to the population, and user responsiveness. These elements are key for health systems to deal with crisis situations. And in a crisis situation, such as a pandemic, an important element in preparedness and response is leadership. And with leadership comes prioritization of pandemic preparedness and building the systems that are necessary to respond to a pandemic that involves intersectoral approach, as we heard from Dr. Maria just now, involving the community, involving women, involving youth, in this. And one of the aspects of a strong public health system in readiness in response to a pandemic are conducting a routine intersectoral simulation exercises where they test communication, they test the connectedness, the integration of the various sectors in order to respond to the pandemic appropriately.
Thank you very much. Ms. Boccoz, you also highlighted the importance of paying attention to the gaps in response to COVID-19 and outbreaks in general. So I would like to bring the question is related to multilateralism. The WHO has played a major role in responding to COVID-19. It's really obvious, and it's been a fantastic response. So how do you see the role of multilateralism and international cooperation among the G20 countries to be enhanced the response and towards the health crisis and beyond?
Thank you very much indeed. It is very clear from what we've been seeing from this pandemic, and also what has been described by our Director General a moment ago, that many countries need support to address their immediate needs, to mitigate the impact of the pandemic, and to help with their recovery. We heard also that the most potent tools to address these issues are global solidarity and unity. No country can find this pandemic alone, so we must really strengthen international cooperation at all levels. Let me take some examples. For example, the pandemic has disrupted production, trade, and transport. hindering the health response at a scale we've never seen before, leaving the health sector with global market failures in production and distribution of key protective and medical equipment supply chains, ensuring that the supply chains and the trade remain open and accessible to all countries is important. And that's one of the key roles that the international community, international cooperation can play. We had these discussions as well with the G20 trade ministers meeting under the chairmanship of the Kingdom of Saudi Arabia, for example. That was an important discussion. Another one is also access to new technologies. And as the new technologies to fight COVID will become available, it is really important to ensure that access to them can be done on an equitable basis. We need to guarantee as an international community that no one, and especially the most vulnerable, will not be left behind. This will require a lot of guidance, a lot of political leadership and cooperation from the G20 countries. These are a few of the areas that come to mind, but it is clear that in terms of exchange of data, in terms of exchange of best practices, in terms of using the different multilateral groupings, be it at regional level, be it on more global level, and with the G20 in the forefront, showing leadership on what is the best response and how to work together as a community is extremely important.
Thank you very much. These are very important points. Dr. Kerkhove, you've been involved in the MERS-CoV response in Saudi Arabia for years. And now COVID-19 comes as a major outbreak. It is the third outbreak of an emerging coronavirus infection. But by far, COVID-19 has been the biggest and largest challenge to human health. How much healthcare systems have learned from previous outbreaks to respond to the current pandemic?
So thank you, Dr. Arabi. Yes, indeed, we've had several outbreaks of emerging diseases in the past decades. SARS is one in 2003. We've had MERS, which you are very well familiar with in Saudi Arabia beginning in 2012, and now COVID-19. But there have been a number of other emerging outbreaks and events that have been occurring across the globe on all continents. And we've all had a chance to deal with these. By far, this one has been the most challenging. One of the things that I think we've learned from our experiences with SARS and with MERS and now with COVID-19, there's three things. One is those countries that have had a direct experience with these pathogens, who have had to directly deal with either SARS or MERS or even smaller outbreaks of avian influenza, knew immediately the seriousness of this. And it came with that direct experience of knowing that the situation needed to be taken seriously, needed to act fast, need to act comprehensively and act decisively. All of these outbreaks are teaching us that we need to have a no regrets policy and act very quickly. And that the fundamentals of public health, which in many countries are very strong, but in others are not, are essential to be able to fight emerging pathogens, even pandemics that take over the globe in a short period of time. These public health measures include what the Director General mentioned today in his speech. It's finding, isolating, testing, and treating all cases in medical facilities, not inside the home, but outside of the home, in medical facilities based on the seriousness and the severity of their illness, to trace to trace all the contacts. Conduct contact tracing. It sounds very simple, but many countries, many industrialized countries, many wealthy countries have not invested in contact tracing in many years, and we're seeing the importance of that now. We've also seen countries that are able to, who have been able to ramp up their testing capacities. And not only that, find creative ways to test, to find patients to test. Where is the virus? We can't fight the virus if we don't know where it is. And to have robust outbreak investigations when we have these super spreading events. And in MERS, we know super spreading events can happen in healthcare facilities. And that's true for COVID-19, but we've also seen super spreading events in long-term living facilities, in places of worship and mass gathering events. And so we have to be ready for the amplification of transmission. We've seen the direct experience and what we have learned is the engagement of the public and strong leadership is critical. Having open, regular, and transparent communication with the public and the outside world is really critical to keep the population with you. So that as the situation evolves, as new science comes in, as recommendations change, the public is informed and can act accordingly. We've seen an all of government beyond health approach that goes way beyond health, making sure that we have the right leadership to be able to work across sectors, that strong leadership in countries, and to be able to harness technology, as has been mentioned before. I would be remiss if I didn't mention the fact that the full genome sequence was shared within 7 days of the cluster being identified. And the first PCR assay was online for the world by the 13th of January, which enabled the entire world to develop PCR tests to find this virus. That has never happened before. And that comes from collaboration, it comes from openness, it comes from science and technology and that advancement, and that's important. The second thing I think we need to learn is about increasing our collaborations between animal health and human health. Most of these pathogens are emerging from animals. Most of them are zoonotic, which means these viruses are regularly circulating in animals, and we need strong relationships with our partner agencies within the UN, the Food and Agriculture Organization, and the World Organization for Animal Health, OIE, to be able to identify these viruses rapidly as they breach the species barrier. And thirdly, just to say what we've learned is that investment works, investment helps. Investment in the workforce to make sure that we have people in place and that are trained, that we have laws in place where needed, public health laws to help us enact measures that are necessary and appropriate, that we have processes in place that can kick into gear immediately when they need to be triggered, and to make sure we have very strong governance. So what was just mentioned by Dr. Reem about simulations, practice helps, simulations help, experience help, but we must learn. We cannot go through another pandemic and have dozens of lessons learned exercise without actually applying those lessons. I think with COVID-19, we are seeing these lessons applied, and that is encouraging, but of course we can always do better. So I'll stop there. Thank you.
Thank you very much. Indeed, great lessons we learned from the past, and we are learning as we go along. Dr. Bunyan highlighted the elements of meaningful healthcare response. You talked about efficiency, cost, equity, responsiveness, and others. How do you assess and how do you describe the Saudi Arabian response to COVID-19 outbreak, given the domain you mentioned?
Thank you. In response to that, it links very nicely with what Dr. Maria just said. The Saudi Arabian, not only health system, Saudi Arabia in general has the experience of dealing with previous outbreaks, and the most recent one is the MERS-CoV virus. And in response to the COVID-19 pandemic, the Saudi Arabian response has been really early and preceded the identification of the first case, which was early in March, on the 2nd of March. And so the measures started in place approximately a month before that, once we started learning about what's happening in the world. One of the elements of our Saudi Arabian response to the pandemic has been whole of government response at the highest level with a high-level committee that's chaired by His Excellency the Minister of Health and membered by approximately 25 government entities. And this clearly helped close collaboration, rapid movement, and response to the outbreak. Another important part of the Saudi Arabian response to the pandemic is as a number of scientific committees that was constantly looking at the latest available science on the outbreak, and together with this releasing guidelines for clinicians on what to do. And we're now on version 8 of these clinical guidelines that are developed and circulated to clinicians very rapidly. The system's capacity has been increased by reassigning the services and redistributing them for better readiness to manage people with COVID-19 infection, in addition to providing services for all layers of the population. Including people who are in the country on an illegal manner, who don't have access to healthcare under normal conditions in an easy way. And collaboration research is an important element that we just heard about by what Dr. Maria said. Our research centers are collaborating with international centers that are doing research. Communication has been a very important part of the Saudi Arabian response. The public is well aware of what's happening. They're well versed with the guidelines and what they're supposed to do. Applying technology has been a key element of the Saudi Arabian response with every possible aspect. I mean, there are a number of apps that are available to people, a number of apps that are available to healthcare providers, ways for them to reach each other and access information and access what they're supposed to do. And lastly, testing. Has been an important part of our Saudi Arabian response to the pandemic, and the capacity for testing has been increased. Up to date, we have approximately 1 million, more than 1 million people that were tested for the COVID-19 possibility of infection. And this is still something in the works. The testing capacity and the target number of people to be tested is still in the works.
Thank you very much for this insightful review. A question to Michelle Boccoz. For the WHO, what are the top 3 strategic lessons learned from this pandemic that might be helpful for future preparedness?
Thank you very much for that question. Well, obviously, we are still right in the middle of the pandemic. I'm afraid, unfortunately, we haven't gone through it completely. So it's probably a little bit early to draw final lessons from that. And then we will need to go through really an after-action review and an evaluation, which, by the way, has been already decided by the World Health Assembly, and we've been tasked to lead that and to go into the details. So I think we will draw more lessons, and we will see more concrete outcomes from that on what we need to do. However, there are a few lessons we can already have at this point. One very important lessons we've learned and that we can share is the importance of responding to outbreak and pandemics, exactly as Dr. Bunyan was saying, with a whole of society, whole of government approach in order to mitigate the impacts. There should be a real political commitment and understanding that health impacts all sectors of the economy, government, society. We would like really to use that as an example to, in the future, avoid the neglect to panic cycle that we are witnessing now. So that, I think, is a very important lesson, to have this focus on this whole of government approach. The second lesson is probably that the pandemic has underlined the critical link between the global health security in general and also what happens at the very, very local level and the local health systems. We are as strong as our weaker link. And so if we do not manage to invest more also in the weakest countries, in the weakest health system, and make sure that we have a chain of data, information, response, that we can apply the policies at all levels, it would be really difficult to combat pandemics in the future, seeing how they spread and how fast they spread. And the third lesson, again, is that fighting preparedness is an investment. It's not a cost. It's really an investment in the future. And we must see the investment in a broad way, including elements such as environmental problems, the climate change issues, the impact now of interactions between human and animals, and a number of other issues that go much beyond the traditional health sector. We must have this vision, and we must invest in those areas, including also the social dimension and the social safety nets, if we want to be better prepared for the future. But of course, there will be much more to come, and the work we're conducting right now with our colleagues from the G20 will surely develop into coming with much more detailed proposals and concrete answers in the future.
Thank you very much. In our response to the COVID-19, healthcare systems have been focusing appropriately on how to manage COVID-19 patients. But there have been concerns, obviously, on managing the rest of our healthcare sectors. So how to mitigate the impact of COVID-19 outbreak on non-COVID public health issues, vaccination, for example, access of care, or even managing patients with acute problems who present with non-COVID problems. There are some studies, and Dr. Maria may be aware of some studies showing adverse outcomes of some subsets of patients who have other diagnoses because of delayed presentation. What kind of policies that we can put in place, Dr. Maria?
Thank you for this really important question. Indeed, countries all over the world are facing increasing demands for care for COVID-19, but not all countries are in the same position. So there are many countries that are able to maintain other health services, while those that are facing increases in transmission and intense transmission are really overwhelmed. We know that COVID-19 is impacting all aspects of public health. We've recently done a survey, and we found that many countries are overwhelmed by the COVID response, and only half of the countries reporting set ensuring a continuity of essential health services as a priority, and only a third have set aside funding to ensure essential services are kept running. Nearly 90% of countries report disruptions in at least one service delivery area, but across WHO regions, 54% of health services are interrupted. And the 10 most frequently reported disruptive services include immunization services, rehabilitation services, dental services, malaria prevention campaigns, NCD diagnosis and treatments, family planning and contraception, treatment for mental health disorders, cancer diagnosis and treatments, antenatal care, and sick child services. And we know that the biggest reason for the interruption of service is not actually a demand issue, it's a trust issue. People are not showing up. They are not maintaining the appointments that they've kept. In many situations, and in others, those services have been canceled. So we have seen innovative ways in which some of these health services can be maintained through telemedicine, for example, but unfortunately, we are seeing major disruptions in essential health services. WHO has put out operational guidance on maintaining essential health services to support governments in being able to keep these up and running. Because as I said previously, saving lives from COVID-19 is not enough. We need to make sure that the lives that can be saved, that we can prevent from other serious illnesses, needs to also be maintained. Within our guidance, we have a whole set of elements about being able to prioritize the services that must need to be maintained depending on the context and depending on the needs of the population, to optimize service delivery and the platforms for which the services are delivered, to ensure that there is safe and effective patient flow at all levels, to optimize the health workforce capacities because many healthcare professionals are pulled away from their normal services to fight COVID-19, to make sure that we have the availability of the essential medications, equipment, and supplies, making sure that we fund the public health and remove financial barriers to access. We strengthen communication strategies to ensure that the population knows where they can receive those essential services, and it goes on and on. We have other guidance out which focuses specifically on the life course and disease considerations, which include everything from maternal and newborn health, child and adolescent health, over older people, sexual and reproductive health services, nutrition, non-communicable diseases and mental health, and communicable diseases such as HIV, tuberculosis, immunization programs, neglected tropical diseases, and malarias. So it's a very long answer because it's a very complicated question. But this involves the whole of government and financial support to be able to ensure that we maintain the essential health services that our populations need.
Thank you very much. There have been a lot of questions been posed to the panels, and I'll try to come through them. But before this, I'd like to ask Dr. Bunyan one question. In the fight against COVID-19, there are many healthcare workers in the front line managing these patients and sometimes putting their health and sometimes their life at risk. What's your message to the healthcare workers who are managing COVID-19 patients?
Thank you for this question. I'm a clinician, and I know, Dr. Yaseen, you are a clinician. So this is really, I'm happy to have gotten this question on this panel, and for the colleagues watching us, I'd like to no doubt give words of appreciation and thanks to the frontliners. And a few words of advice for the frontliners on their role at this moment. They are the most important element of the response to the pandemic. And so my words to them are to be strong, to be flexible during these strange times, and continue to do what they do best in the care for patients. Stay abreast with the latest information on the pandemic. Follow the guidelines. Don't try to be creative. Follow the guidelines. Stay informed. Work in teams. Usually teams function in a better way. Use your PPE and self-protective equipment carefully, and take care of yourselves in this stressful time. And to end it with more words of thanks and appreciation to the frontliners in this battle.
Thank you very much. Thank you. Much appreciated. There are many questions from the attendants, and some great questions. I'd like to bring as many as the time allows. So there is a question to Michelle Boccoz about the availability of vaccine and treatment. The question is from Ranja Scheller, Program Director with Corporate Foundation and the member of T20 Task Force 5. The question is, how can we make sure that the COVID vaccine or treatment will become a global public good? How can we raise incentives to state, but also for the pharmaceutical companies involved to engage in a fair distribution process?
Thank you very much for that question. I think it's a very important topic. our Director General, Dr. Tedros, and a number of countries, including the G20 presidencies and many of the G20 countries, launched on the 24th of April what we've called the ACT Accelerator, Access to COVID Tools Accelerator. And the principle that was really at the core of this call is to make sure that the new tools, be it vaccine or therapeutics or diagnostic tools, are made available to everybody on an equity basis, to those in most need. So basically, we must make sure from that structure that no one is left behind. Of course, to do that, we needed to have also financial support, and there was a pledging conference launched by the European Union from the 4th of May that is still ongoing, and that will bring funding to help support the access to all those products as a global public good for all the most vulnerable and the most fragile. A whole system is being put into place at the moment with a new very light structure, but that would be dealing with each of the pillars: vaccine, therapeutics, and diagnostic, working with the private sector as well to engage them into making sure that the new products will be available on an equitable basis. So this is for us an extremely, extremely important initiative. We also launched the second initiative called Covid-19 Technology Access Pool, or CTAP, which builds on the accelerator by asking countries to also share knowledge as a global public good, which means also share health technologies, intellectual property, and data, and pool it for COVID outbreak on a voluntary basis with a medicine patent pool so that everybody can use them. It's really sharing knowledge as well as a global public good so that new tools can be found and can be developed and can be shared much more rapidly and in a much more equitable way.
Thank you very much. Next question is related to disparity maybe between cities, large cities, and different locales in areas. This question is from Dr. John Duke Anthony, President of the National Council on U.S.-Arab Relations. The question has to do with the healthcare systems and area between large cities and locales. Large cities and many centers may have far better healthcare systems than in areas in between. Often the number and quality of medical professionals, availability of healthcare system, or even the availability of supply and appropriate medicines are far less available in these areas. COVID-19 can be overwhelming for the medical healthcare personnel in such less well-resourced places than in large cities. So how can we address the disparity between cities with different resources? I think this question maybe to Michelle, if you like.
I think maybe Maria would be answering that question. Thank you.
So we were deciding who would speak. I can start, and then maybe other panels members would like to. I mean, this is a very good question, and I think the point of mentioning the cities I know came from another question. We speak here in particular at the global level, about what needs to be done, but all of this needs to be adapted and implemented at a strong national program, but at a local level and at the cities, and the city leadership and the people in communities are fundamental to making anything a success. With regards to your specific question, I think given that there are disparities and differences in medical facilities depending on where you live, what we've seen with this particular pandemic, and we've seen with other large outbreaks, is that the response is adaptive. So if the outbreak is happening in a location where there aren't enough medical professionals, we've seen medical professionals be moved to other locations within a country. This was certainly the case in China in the beginning, where there were tens of thousands of healthcare workers who went to Wuhan to offer assistance. We've seen in other countries where they don't have tertiary facilities that treatment centers are built or patients are moved from one part of the country to another. All of this requires infrastructure, it requires organization, it requires planning. But we have seen creative ways in which if the facilities and if the people don't exist in the location where that outbreak is, people within that country go and help. But it's about being creative. It's about ensuring that when we do build back better, we do consider this. We do ensure that there are facilities where people live and that they have access to those in a logical time frame.
Thank you very much, Maria. There are two questions. I'm going to combine them together because they are connected and they are very important. So a few months ago, we didn't know anything about what's COVID-19. And as the cases are increasing exponentially, the scientific evidence and studies are increasing similarly exponentially. And it's really hard even to keep up. But that reflected on the guidelines and the guidance given related to COVID-19. So the two questions asking information and guidelines keep changing, and sometimes they are contradictory, and to the point that they may affect credibility and reliability of health officials and systems. How do we respond to this point, which is, I think, it's an important one?
So perhaps I could start, and then I will let others. This is a hugely important question. On the one hand, it's incredible the amount of science and knowledge that is coming 6 months into a pandemic. We are learning every day. We are evolving our understanding every day. That should be seen as a positive. But I can understand from many points of view that that may be confusing, and it may seem like we don't know enough. But what we try to do within the World Health Organization is when we are developing our guidance, we are reviewing all literature, everything that's coming out. And I have to say, not all studies are of equal quality. And so there is an assessment of the studies that are coming out to evaluate, did they measure what they attempted to measure? What are the limitations of those? We work with international networks of thousands of scientists and public health professionals across the globe, pulling together their not only experience in conducting research, but their firsthand experience of dealing with patients or whatever role they have within this pandemic, to discuss and constructively debate, what do we know, what don't we know, what does this research finding mean? And then we work with them and guidelines development committees to come up with our guidance. It's a very interactive process. And we are constantly looking at everything that we publish in our guidance. We're constantly looking at and constantly updating based on the latest science. But it is certainly a challenge. One of the new things in this pandemic is the explosion of preprints. So these are papers that have not undergone peer review, but are online and publicly available. So again, on the one hand, it's wonderful to see the release of this, but they haven't gone through peer review. And peer review is a robust process by which the authors are challenged on every line in that paper. And oftentimes what is ultimately published isn't the same as what goes online as a preprint. So we are working with many, many people, and we are so grateful. And I should take a moment to thank all of our partners and collaborators who are working with us to develop these guidance and to put it into practical use for those who need it most.
Thank you very much, Maria. I think this has been great discussion and fantastic exchange, really very informative and insightful. Because of time, unfortunately, I have to bring this session to closure. And I thank you again, Dr. Reem, Dr. Maria, and Michelle for your insights and great comments. Thank you.